Hi everyone, this is Dr. Demetrios Kydonieus, chiropractic nutritionist. I'm here with one of my patients, and actually my very first patient in my Central Virginia practice that I started 3 years ago, Maria. And Maria has had some health issues, but has come through them really well. And I wanted to let her tell her story to folks out there. Maria, now, before me, you've seen chiropractors a long time.
I've had chiropractic care since I've been 10 years old.
Okay, so you started as a kid and
Right.
generally have had a pretty good lifestyle health-wise.
Yes.
Okay, now you're also a massage therapist and an energy person.
I'm a massage therapist, yes.
Very good.
For 20 years.
And so now I know recently then you'd kind of just been busy, like a lot of us get out of the habit of going to chiropractors, or it was a little inconvenient in your case because it was quite a ways from your house to the
Right.
nearest chiropractor, until I kind of came to town and opened up an office. You got referred to me by a mutual friend of ours, and we've been good friends as well as doctor-patient ever since. So during your time here in the last 3 years in our office as a chiropractic patient, what's been your experience? You kind of were coming in with, you didn't really have specific pains. You were really here for just the health of it, right?
You're right, just a tune-up. People ask me if I believe in chiropractic, and I say, well, I don't know if I believe in the dentist, but I go to the dentist, and it's just like we need to preserve our teeth, we need to preserve our spine.
Awesome. So chiropractic's not really for a pain relief, although it's good for pain.
Right.
But you don't really use it because your back hurts or you get headaches. You use it to keep your spine and your body tuned up or healthy, as you put it, right?
Right, so I can be as active as I want to be, so that I don't feel like just because I'm getting older I can't do what I want to do.
Exactly. So now I also know recently, in the past, about 2 years ago, got some not so good news. It was actually something that I was able to help you find, or I discovered it in your health, and it turned out that you had a brain tumor.
Right.
And I was able to diagnose that and get you to the medical doctors and the surgeons who did wonderful work, and you're here today ahead of everyone's expectations, and you look wonderful, and you're having a really active lifestyle. Tell the folks, how do you think chiropractic affected your recovery after the surgery from having a tumor? It was what? How big was it?
It was bigger than the size of a walnut, and then it had a long tail that went around and filled up the cochlea of my inner ear.
Okay. And they were able to get most of it out, but still they had some reservations about your recovery, correct?
Well, they didn't express any reservations, but they expressed a lot of surprise that I recovered as well as I did. And I can honestly say that I had more structural pain in my body from being an invalid and laying in bed after surgery than I had from the brain tumor.
Right.
That as long as I was laying on the sofa, I wasn't in any pain, but when I would get up to move around, it hurt so much I didn't want to move around. And you would come adjust me, and then it would be easy to move, and then I'd be motivated to move. And of course, as we know, the more you move, the more you can move. And so, that really helped me get up and get going.
And then, of course, I know you're also into kind of eating healthy. You do a lot of healthy food choices at home.
Right.
You juice fairly frequently compared to a lot of folks, so you're trying to get a lot of nutrients that way.
Right.
You take vitamins when you need to. They're not a huge part, which is wonderful if you can do it from your diet and you have the time to do that. But we were also kind of able to kind of steer you into the direction of food groups that would help you heal and reduce inflammation,
Right.
or help combat the side effects of some of the medicines you had to take for a while, correct?
Correct.
Okay.
I'm pretty knowledgeable and opinionated about food and healing, but you've helped keep me on the right track and guide me, because it's good to have support and encouragement even when you think you already know what you're doing.
Well, definitely a coach, someone looking in, is always good, and I know that's what I try to do here in the clinic at Life Enhancing Chiropractic. So again, now overall, a lot of adjustments, recovered quicker than the MDs thought you would recover.
And I had a fuller recovery than what they expected.
Very active. In other words, not a lot of rehab, not tremendous handicaps per se.
No, and part of that is I've done what I'm supposed to do. I did the exercises I was supposed to do, and good diet and meditation and
adjustments, real regular chiropractic. Mm-hmm. Yeah, I know. I remember when you were asking if you could drive again. How come it is when we have a handicap and driving seems to be one of the most important things to us, which I guess we become so dependent on being mobile, and that's what driving's about. But I remember it was a process, and as your vision improved and your coordination, and you were driving around parking lots with family members, and then finally they said, fine, if you're going to do it, I'm just not going to. And then now you just drive, now you're totally normal and driving everywhere and getting adjusted. Like, see, you were getting adjusted 2 and 3 times a week during the recovery phase for many, many months. Even though there was no significant pain we were treating, we were just trying to make sure that this nervous system was subluxation free. In other words, that there were no pinched nerves, that the spine was straight. And that's really what chiropractic does, is it keeps the communication between the brain, down the spinal cord, out the nerves to the body, so that people can be connected to that the intelligence that makes our life run and work good. So that's a great thing. So now we're coming up, it's a 2-year anniversary?
2-year anniversary.
This summer, again, doing great. And I remember you got some really good news that they thought there might be a chance something might come back, but actually it's been doing pretty good.
Yeah, I've got 3 MRIs that are all clear. Everything looks good.
So that is awesome. So again, having and Marie, you have one of the best attitudes, really, and I help people on a lot of different levels. Attitude is so important in the healing process, whether it's just from a sprained back from mowing the lawn, or let alone something so severe as dealing with recovering from having a tumor removed from the head there. And you have always been upbeat and positive, that you're doing the right thing, you're here for a reason, you're doing what you're supposed to do, and that what more could I ask for? And you always have a smile on your face.
Well, I try.
A little bit of some nerve stuff still happening from where the tumor was. It affected the facial nerves. Mm-hmm. And I know you're going to be going in for, compared to what you went through, a minor procedure compared to that, but still a fairly invasive procedure to try to do a graft to give you some nerve control for the smiling back. So that's exciting. So we're pulling for you. And on that note, you've been coming in before your surgery the last 2 weeks. You've come in really repetitively, even though you feel great. You've been coming in to have your spine checked just for an adjustment. And of course we do a little cold laser therapy, which is great for healing as well. Just to make sure that your body is in the best shape to handle the surgery, so that, I think you said going into it feeling good means you'll recover faster and feel good quicker afterwards. So.
I want to be at the highest level of functioning as I go to the surgery, so that I can come out of it at the highest level of functioning as possible. And I will say, in addition to the things we've talked about that I did to help myself heal, that a good support system is part of that, and you've been a primary part of my support system. I didn't do this by myself, and I did have good doctors and people who helped me, but you were the first person who got a very hard-headed person pointed in the right direction. And at the time I wasn't particularly grateful for you telling me to go to a doctor, because I consider chiropractic to be a form of alternative health, and alternative health people aren't supposed to tell me to go to the doctor, but you did the right thing. As a result, I got in early enough that the treatment was able to be sufficient to basically save my life. So you didn't do the brain surgery, but you got me pointed in that direction.
Yeah, I remember you were hesitant to go get that first MRI that I was referring you out for, because I knew you had neurological symptoms.
I was actually angry with you.
Yes, you didn't come in for a little bit. You missed an appointment for 2 or 3 weeks, and then you did come in, and I was still like, we still have abnormal, nerve signs that say there could be something going on up there. And unfortunately, it turned out to be something that was pretty serious. But
well,
we got you
I got a
there.
lot of good arguments, but you didn't let me win.
I didn't let you in. Being holistic and natural is great, but there's a time and a place for everything. Even with allopathic or medical doctor medicines, you know, they do great things when they're needed. The idea is, though, rely on natural healing to maintain your health, but when emergencies happen or something just goes awry that you have no control over, having the emergency or the sick care specialist, that's what the medical doctor is, to help you is the best place to be. And that's, I can support him, but I may not have everything you need to get well. And so that's why working with medicine as a chiropractor and a nutritionist is paramount to the way we practice here.
Well, and you know enough about medicine and what doctors do that you did handle me well and point me in the right direction. And you know, knowing as much as I think I know about taking care of the body and health, times that I don't know it all, and I need somebody who can overcome my resistance when I'm resisting in the wrong direction.
Yeah.
And so I really do have, you know, great gratitude for you dealing with my hard-headedness.
Well,
because it saved my life.
I'm glad you're here, and I want you to be here for many, many more years to come, just like all the people I love and care about. So how about you give me a big hug? Oh, sweetie. It's been wonderful, and I'm honored that you've chosen me to help you on your journey to enjoy life. Mm-hmm. So you can, as I say, live to 100 and feel great without drugs or surgery unless it's needed, is a wonderful thing. So I want to thank you for doing the interview.
I also want to say, Dr. D, that having had a lifetime of chiropractic care, I recognize the quality of your chiropractic care. And what I tell my friends and people I refer to you is that you're the best one yet.
Thank you. I appreciate that. I'm just so humbled to get your acknowledgement, because I know you've been in the alternative world for a long time and you're familiar with a lot of different forms of healing, and from massage to even other things out there, other chiropractic techniques and so forth. And so I really value that comment and that praise. I cherish that, so thank you.
Well, and I can also say that I had some resistance to your technique because I was used to kind of the hard thrust, snap, crackle, pop that a lot of people don't like about chiropractic, but I liked it. And you did what you do well, and it's worked well for me, so I've gotten over thinking I need to hear my bones pop to know that I got a good adjustment.
Exactly. We use, for the folks that don't know, I use an instrument, a high-speed little rubber tip deal, pushes the bones back in place with speed instead of muscle. Does a lot of other technical things in the neurological reflex area as well, but you don't really feel much, so it's not as impressive as the manual or snap, crackle, pop kind of adjustment.
And it's not as scary to people who don't like that snap, crackle, pop.
Yeah, so we do specialize in that. I've done that for, even before I graduated. I learned that technique in college, chiropractic college. So I've been doing this almost 30 years now. But so it's been able to help a lot of folks, along with some of the deep tissue work. And when I do need to use my hands, I do have a few patients that respond better if I do the old-fashioned manual snap, crackle, pop, as Maria calls it there. It's a great adjusting technique, and I recommend it. It's just knowing what technique to use on what person, and that's what a good chiropractor should be able to do for you out there, as opposed to doing the same thing to everybody that walks in the door. So, but again, Maria, I want to thank you for sharing your story with everyone out there. You're okay again with us kind of showing this maybe on our YouTube channel, on the internet, and sharing it. Hopefully your story will inspire somebody to find a chiropractor if they've not found one. So again, folks, this is Dr. D, chiropractic nutritionist, signing off. Tune in next time for another great story from another wonderful person. Bye-bye.